All right, welcome everyone. I am so happy to welcome you here this evening or wherever you're at in the day as you tune into the recording. Today, I'm excited to share with you the voice of Lauren Alicia, who is a phenomenal doula and herbalist based here in Los Angeles. I'll let her introduce herself in a moment, but I wanted to just start off by again welcoming you. I have extended this invitation out to our wider Ayurvedic Mamas community. So please let us know if you have questions. You're welcome to enter them here. Send me an email, a direct message through any of the social media platforms. We're here to support you. So Lauren Alicia, as I mentioned, is based here in Los Angeles, and she's up to some pretty phenomenal things these days. I met her probably 4 or 5 years ago when she was actually my postpartum doula. After I had baby girl Sienna, who is my 4-year-old, my second child. Lauren was there every single day throughout the first few weeks and doing all of the incredible meal preparation, all of the incredible body work. And since then, she has really dove into just the study and practice and practical understanding of bringing the herbs into the way she supports women. So I'm honored to welcome you, Lauren. Thank you for being here. I'll let you take the floor for a moment to introduce yourself.
Sure, thank you. I'm so happy to be here. Yeah. Hi everybody. My name is Lauren. I have been a doula for a little over 6 years now, and like Jenna said, I have a focus on herbalism and holistic healing practices. And I took Jenna's course and worked with her when she had her baby, and I really feel like this course, changed the course of my career as a doula. I really felt inspired through Ayurveda around herbal medicine and how that they had integrated it into their protocols for postpartum. And it kind of really expanded my mind of like this ancient medicine and this culture has been doing this for centuries, and I want to learn more specifically about the herb part. But I've also been doing Abhyanga in my doula practice ever since I did the training with you, Jenna, and it's one of everybody's favorite things that when I come over is
I
the
love it.
Abhyanga. Yeah, and also like, through my study in herbs and studying the body and how the body works, the lymphatic system is extremely important in the body, and Abhyanga massage is a lymphatic drainage massage. And so I've just seen firsthand just like amazing results and healing through my clients. So yeah, I just wanted to give praise to your course and how I really feel like
Oh,
it impacted me in my
thank you.
doula career.
Thank
Mm-hmm.
you. That's right. You were at one of the first in-person trainings that we did in Santa Monica a number of years back. Um,
Yes.
and since then, we've turned it into an entire virtual course that our members of Ayurvedic Mamas, as well as other practicing doulas, have enrolled in and really just, taking that first step of learning just the science and practice of applying this healing hands-on tool, which I feel like is such a significant component, right, of postnatal care is sharing the hands-on. And
Mm-hmm.
it's clearly a piece of doula support within the birth realm, but when it comes to postpartum, um, setting that container and holding that container of space that allows for a woman, a brand new mother, to go through the process of healing is so important. So I'm so glad you were able to be here for it and then come and share your magical touch, healing touch with me after I had my little one.
Oh, yeah. It feels like so long ago. It's just crazy how time
Oh,
flies.
tell me about it. It feels like a lifetime ago.
Totally. Totally. For me too.
So, tell us about kind of what was your jumping off point to go from becoming a doula and studying Ayurveda and using the hands-on practice and then diving a little bit deeper into the herbs?
Yeah. So I guess that goes way, way back, because that's kind of how I grew up in a lot of ways. It was holistic medicine was very prevalent in my household, and in my maternal culture. My mom is Native American and Latin, and that was just baked into our everyday of using plants as medicine and kind of really tuning into the body before looking externally into like Western medicine. So that was kind of just like always ingrained in the way that I thought about health in general. And I'd always been interested in herbs. And then, like I said before, once I did your Ayurvedic training, and I just, felt um just the wisdom and the knowledge of Ayurveda and how that they incorporated herbs, it gave me so much confidence because I feel like there is a stigma around using herbs during pregnancy and postpartum. And if you use Google and you Google like, can I drink lavender tea? They're gonna say, don't do it, you're gonna die. Like, and that's just like not correct information. So I was very curious. I was like, well, what is the truth? Like, what is actually happening in the body? Like, how do herbs interact with somebody who is pregnant or postpartum? So I sought out a foundational herbalism training, and really dove into the science behind herbs, with the focus of my practice, pregnancy and postpartum, and just cultivated the knowledge of the body systems, how herbs work with different organs, and also seeing real time results in my clients. So just really getting confident using herbs through my practice and on myself as well. Any herbs that I give clients, I have taken before personally.
Mhm. Yeah,
So I really have
love
that
that.
relationship. Yeah, yeah. Because I think that's another thing too in dispelling any kind of stigma around using herbs. I think building that confidence comes with knowledge and personal relationship with these
Yeah.
plants.
Yeah.
Yeah. Mm-hmm.
One of the really cool things about Ayurveda when I was studying at the Institute of Ayurveda at Mount Madonna, Northern California, like 15 years ago,
Mm-hmm.
um, we certainly spent, months, years even, like looking at basic Ayurvedic herbs.
Mm-hmm.
And that came along with learning about um, diet and lifestyle and yogic
Mm-hmm.
practices. In fact, diet, lifestyle, yogic practices, and the use of herbs, those are the four main components of applying Ayurveda to someone, either for healing purposes or just for maintenance of health. And that's a really cool thing about learning about the herbs in this platform between, the wisdom that you're sharing is it's not just putting a question into Google and getting the answer, which anyone really can do, but it's understanding how to integrate it, right? It's understanding
Exactly.
how to use it on an individual basis,
Mm-hmm.
and how it individually can apply to each of your clients.
Mm-hmm.
Um, different benefits that it's going to have on your body, different effects that it's going to have on individual bodies. I mean, it all goes so it just there's so much information to it, and it's constantly forever an art of discovering and uncovering. Um,
Mm-hmm.
yeah, so yay. So yay for what you're
Yes.
doing.
Yay. Yes. Mm-hmm.
Um, okay, so I mean, there's so many different uses of herbs in
Mm-hmm.
the postpartum period.
Mm-hmm.
Um, just off the top of my head, I use herbs with my clients by putting a tea together for them. I use herbs in, some particular dishes that I will prepare for my clients, like the spiced milk tonic that might have a little bit of licorice root. It might have a little bit of, other things that I can incorporate into it. Um, and herbs can be cooked into oils, right? So all of the
Mm-hmm.
oils that are used through Abhyanga, which
Yes.
Lauren and I have been talking about Abhyanga. Abhyanga is an Ayurvedic warm oil massage. It's incredible. It's so beneficial and so grounding and so deeply, deeply healing. And yeah, the oil used for those treatments, it's heated just a little bit above body temperature. And typically, different herbs are cooked into the oil. So, anyways, that's just to say there's so many different ways that herbs can be used. I think a really common way is through a postnatal sitz bath, which I
Yes.
use. I support my clients with the use of sitz baths
Hmm.
commonly.
Hmm.
But what are some of the ways that you most frequently use herbs in your practice?
Yeah, that's a great question. And yes, very, very complex question too, because like you were saying before, if you're going to talk about herbs, you have to talk about nutrition, and you have to, in holistic medicine, it's the whole body. So it's not like allopathic medicine where they're targeting symptoms and you kind of go straight to there. It's in holistic medicine, we're treating the entire body through each of the organ systems. So like you were saying before, I'm never just giving people the same herbs. I'm always asking questions. So this is kind of how I go about doing that. After a birth, if I wasn't present at their birth, then I ask for a recap of, what happened. Something that I always ask is, did you have a normal amount of blood loss that is normal for birth, or was it excessive? Different things. How long was your labor? And I kind of put together a protocol from there based on their needs. What I most often see, though, almost always, is mineral and iron needing to be
Mm,
replenished after birth. And that's kind of like my priority too, especially for breastfeeding. Breast milk is made through our blood. So helping the mother replenish their mineral levels and their iron can make them feel better quicker. It can prevent things like high blood pressure or any tension headaches, anything like that. Um, and also help with breastfeeding. So that's kind of something that I most commonly use with clients is focusing
amazing.
on iron and minerals.
Yeah.
And I do it through a couple different ways, either a tincture or a tea, like a
Okay.
strongly infused tea. Hmm.
Okay.
Um, and then similar to you, the other main way I use herbs as well is through the sitz bath,
Right.
depending again on what their birth, what went down in their birth, what they're needing, and other things that might come up. Sometimes BV is common after giving birth, or yeast present, things like that. I always really am trying to look at the bigger picture with herbs and health in general. But yeah, those are kind of like my main two things that I see with
Nice.
most people.
When
Hmm.
you use tinctures and teas for purposes of like replenishing minerals and irons, at what
Hmm.
point do you usually start using that with with your clients?
Yes, so pretty immediately. I
Okay.
usually come with my clients as soon as they give birth. So usually I'm there within a couple days after they've given birth. So it could be as soon as that. Of course, I'm always checking in with my oop, sorry
Bless
about that.
you.
Oh, sorry about that. Hold on one second. Oh man.
No worries. Take your time.
Okay, let's see. Oh, pretty dark. You know what? I'm actually in my car because I just got home from a client.
Oh,
Um, so I think my light went off in my
oh
car.
no.
I know. But I'm right outside my house.
Okay.
So maybe would it be okay to pause very quickly so I can just go run inside?
Yeah, absolutely. I'm gonna just
Okay.
hit pause recording.
Okay, perfect.
All right, welcome back.
Thank you. Sorry about that.
So we were discussing, you typically begin the use of herbs, um, pretty immediately, it sounds like.
Pretty immediately, yes. I'm always checking in, like I said before, based on what happened in the birth,
Right.
and checking in with my client of what feels good for them.
Yeah.
If they want to start right away, I'd recommend that. And also, like we're mentioning previously, I'm also checking in with their nutrition. So I'm not always just going to be like, the herbs are going to be enough. Like, we're going to address everything with the iron through
Right.
herbs. I'm always addressing through nutrition as well. So, but
Nice.
yes, pretty immediately.
Okay.
Mm-hmm.
Um, that actually leads me to a next kind of a big question is I'm curious. So I'm gonna preface this with saying Lauren is like you're slammed with clients, right? Like you typically see what, like
Pretty
two
busy.
clients a day?
Yeah, yeah. In a busy season, I'm seeing 2 clients a day. Yes, yes.
So busy. And
So busy.
so, you see some clients, I'm sure, that are just super into it and like can't wait for all of your wisdom, whether it's Ayurvedic or nutrition or body work or herbal. And then you also see clients, I'm sure, like the rest of us,
Mhm.
who don't have any experience with it so far. And
Yes.
so, how do you approach that? How do you handle that? Both with someone who's not been exposed to the use of herbs, but then
Hmm.
also when someone says, no thanks, I might not be into it, or someone that might just be like more skeptical of it for whatever reason, they might just not have like the knowledge, I guess. So yeah, just
Yep.
your approach with that.
That is a very, very good question. And in a lot of my herbalism training, especially clinical herbalism, where you're creating protocols for people, this is a big one, is meeting people where they're at and coming to them in an approachable manner with herbs. Because like you said, some people may never have had any experience with herbs. Some people may be skeptical. Again, there is a stigma most times around herbal medicine. So for me in my doula practice, I never push herbs ever. I express to my clients that this is an area of expertise for me. This is a passion of mine. I do my host spiel of like, I've seen real time like how much this can help. And then ultimately it is up to my clients if they want to partake in herbs at all. When I find that is the case, where they're like, I'm gonna skip that part. What I do is I focus on nutrition. Um, I'll also check in with the supplements they're taking. If they're taking magnesium, if they're taking anything like their vitamins, I try to focus on that. And then Abhyanga, that's another big one that I use. Um, and if anybody has any questions and they want deeper knowledge, like I'm happy to like provide that for them or explain a little deeper of how herbs work in the body if they're open. Um, but in general, I'm really trying to meet people where they're at. And, if somebody doesn't want herbal medicine, like I don't take it personally. I'm like, okay, no problem. Yeah. Oh, no, I can't hear you. Is it like when you do a certain thing? Okay.